Our product is MIDAS, the Medical IoT Data Analyzing Sock. Our company is called MedBioSensors, and we have our website, MedBioSensors.com.
Hello, we are MIDAS, and we are a group of students who designed a sock to help diabetic patients through foot care. According to the Center for Disease Control and Prevention, diabetes is a dangerous and challenging disease that affects around 34 million or 10.5% of Americans. In America, around 1.5 million people are diagnosed with diabetes each year. The disease is caused by a person's immune system attacking and destroying its insulin-producing cells, also known as beta cells. The inability of the body to properly use insulin, or the absence or an insufficient production of insulin, causes diabetes.
Insulin is a hormone produced by the pancreas that helps control the level of glucose, sugar, in your body, and lack of it can cause high or low blood sugar levels. There are many side effects from abnormal glucose levels, such as effects ranging from mild, like having a dry mouth, increased thirst, excess sweating, and excessive hunger. But it can also have severe and fatal effects like heart diseases, heart attacks, and kidney problems. There are many diseases and problems in the foot. Foot care is very important for people with diabetes. There are problems that may occur with lack of proper foot care, such as amputations of the lower limbs, problems with blood perfusion, toe necrosis, peripheral ischemia, and diabetic neuropathy. 85% of all amputations are due to a problem from diabetes. Ischemia is a reduction in the blood supply to a viable tissue of a patient, and it can lead to infections, which causes bigger problems for a patient. A type of ischemia, peripheral ischemia, which is rooted in the lower limbs, is a risk factor for toe necrosis in diabetic patients. Diabetic neuropathy is a type of nerve damage that can occur if a patient has diabetes, and it most often occurs in the lower limbs and feet. Diabetic people need to maintain good foot care to ensure these problems will not happen, and our product will help them with that. We'll gather and analyze the data given from the sensors on the foot and will let the patient know of problems before they get extreme. Time. Our product, MIDAS, which is an acronym for Medical IoT Data Analyzing Sock, will help patients monitor and look for problems caused by the disease. MIDAS is a sock made of cotton that is integrated with or so sensors, depending on what version you are getting. The regular version comes with a pulse oximeter, a motion sensor, a moisture sensor, a pressure sensor, and a temperature sensor. There is a MIDAS Plus, a variant of MIDAS that specializes in wound healing and utilizes a printable chemical nanosensor, a NASA patented technology, to look for specific wound healing chemicals and molecules, chemokines, and cytokines. Using these sensors, the sock will measure blood perfusion, record your sleep pattern, check if a new wound has formed, or if an old wound has reopened. As well, check for edema, as well as look for nerve damage. Edema is a swelling caused by excess fluid trapped in the human's body tissues. MIDAS will also be a huge help to patients with diabetic neuropathy. Neuropathy causes you to have a burning or tingling sensation, which will cause you to not be able to feel pain or change of temperature in your foot. Using our pressure sensor, you will be able to raise any red flags if there is a problem that the patient might not be able to feel. All this data will be collected and shared on our website where a caregiver or yourself can access.
As you can see, the 3D model shows all the sensors that our product utilizes on a foot. The first sensor shown is the one on the big toe, which is the pulse oximeter. It is connected from a wire to the data collector. The 3 circles on the bottom of the foot are the temperature sensors and are wireless. The motion sensor is on the side of the foot a bit above the ankle and is relatively close to the data collector. It gives information through IoT. The band-aid shape that goes around the foot is a pressure sensor which wraps around the foot to cover most of the area. The moisture sensor is on the back of the foot and in our product is customized size for the patient. On MIDAS Plus, which is not shown is a printable chemicals and nanosensor, a technology patented by NASA.
Diabetes is a big problem for people with weight issues as well as older citizens. Our product will be marketed to the global diabetes care devices market and will be sold typically to nursing homes as well as people in the healthcare department. It can be bought from our website, MedBioSensor.com, and sold commercially to diabetic patients.